Doing trach care in the home health environment is a little bit different than in other environments. First of all, we're not going to be using a sterile technique. We don't get supplied with the items we need to use a sterile technique. So we're going to use an aseptic technique or a clean technique. And the first thing you need to do is get your supplies together. Usually we're going to use about 4 to 8 cotton tipped applicators. You're going to need a drain sponge if they use one, some gauze, whatever cleaning solution that's ordered. It may just be distilled water, normal saline, half-strength hydrogen peroxide, some sort of acetic acid solution, which is normally vinegar and water. But whatever it is, go ahead and get it. You don't need a whole lot, maybe 1 to 2 cc's. Washcloth if you need it, and some sort of roll to put underneath their shoulders. When you first come up to the child, after you get everything gathered, go ahead and wash your hands and maintain first precautions throughout. If they're on aspiration precautions, they actively have the tube feeding going, go ahead and turn it off. Because you just turned it off, if they're on aspiration precautions, you'll leave them up at an angle. And you can go ahead and still put that roll underneath their shoulders. But if not, you can go ahead and lay them flat and put that underneath their shoulders. I didn't bring the roll with me, so this is our roll. Just to hyperextend their neck just a little bit. If indicated, go ahead and suction their trach if there's secretions present, or if they haven't coughed for a while, you might want to go ahead and simulate a cough just to go ahead and clear it all out now instead of after you start. Then, when you're done with that, go ahead and remove the drain sponge if they have one in. Always, whenever you're doing anything around the trach, secure the trach because you don't want to move the trach. Even though it is secured, you can still cause a lot of irritation and trauma on the inside. But go ahead and remove that old dressing. Usually I'll get a bigger piece of gauze and dip it in the solution that we're using, moisten it a bit, and try to get off any gross contaminants, any large amount of secretions or phlegm that might be around the trach, and try to get that off before we get the Q-tips. And set that aside, then moisten a Q-tip with the cleaning solution. Usually one for each side. One for the bottom, throw it away. One for the side, throw it away. The top, the other side. But also you want to wipe from the stoma away. You don't want to wipe toward the stoma. And that on the side, get another one up here. Sometimes it'll help if you kind of roll it through to get in there. Try to look up underneath, see if there's anything. Back over here to the other side. May not be a good idea to cover the kid's face. Make sure you get any dried secretions that might be around the stoma. And also you want to look at the stoma too to see if it should be normal skin color or pink. If it's red or inflamed, then it probably calls for a little bit of Bactroban afterward. And usually that is on hand and ordered PRN. If it's any worse than that, if there's a change in the color, the volume, or the smell of secretions, be sure and call a parent, let them know, and probably call a doctor after that because you'll probably need some antibiotics. Once you get that clean, if you have used any cleaning solution besides normal saline, you probably want to get some regular tap water or distilled water on a Q-tip now, and now clean off the cleaning solution. Especially if it's hydrogen peroxide or acetic acid, you probably don't want to leave that on the skin because if it does remain there, it'll probably cause some breakdown and some irritation. Now that you have that done, and you can take the last one and dry it off so it doesn't remain wet as much as you can. Don't look at the trach, they're going to cough at you. Then If you have a drain sponge, you want to put it back on. They're never really easy. You can use the Q-tip to push it underneath. One really neat way to do it is to roll it back on the Q-tip. Put it right up here under the edge and try to roll it back under. They are going to cough at you, so just try to do what you can. Clean it up afterward. Try to do the best you can. Try and poke them in the eye with it. The trach care is usually done twice a day, once in the day shift, once in the night shift, and PRN if they do soil the drain sponge or if there's a lot of secretions, which there shouldn't be. And set them up and we're all done.